How are you?
Good. My name's Nicole. I'm from the quality department at the hospital. And so one of the things that we like to do is come around and talk to you and maybe look at some documentation, ask you some questions. Would you have about 10 minutes to talk to me?
Sure.
Okay. So, and what was your name?
Jamie.
Jamie. It's nice to meet you.
Nice to meet you.
So how long have you been with B-Bay?
I've been here for 5 years now.
Okay, great,
Mhm.
great. So I see you have, it looks like you're in the middle of documenting something.
Yes.
All right,
Mhm.
great. So what I'd like you to do is maybe show me where some things are.
Sure.
For this patient, Kelly, can you show me where the H&P would be kept?
Sure. The physician's history and physical, we would go right into notes. And then we would be able to document or open the folder that they document on. And it would say what physician did it at what time, and the H&P would be right in here.
Okay.
They've just not done one yet for this patient.
Okay.
She's been here less than 24 hours.
Okay, that's important. So
Mhm.
you're aware that there should be an H&P within 24 hours of admission.
Mhm.
Okay, Jamie, so something else we're very interested in is pain. So can you talk to me about, what you would do with pain documentation for a patient?
Sure. For this patient, when she came in, the first thing that we do is an adult patient history admission. So we go through all of these items, but one of them is the pain history reviewed. So it asks us if pain is present, yes or no. And so when we document that, it will carry over once we save this form into the iView fields. And that's where we can do a more extensive pain assessment.
Okay, and I can see on this patient that you have said, yes, there's actual pain.
Yes.
And then it prompts you to go to the full pain assessment. Can you show me that, please, for this patient?
Sure. So this is the pain assessment section. It's in the interactive view in INO, and you can get to it via the adult quick view section. So here you can see we documented that yes, pain was present. That pulled over from the form. And then we have to document the preferred pain tool. We also document their pain rating and their acceptable pain at rest and with activity.
Okay, so you've got that yes, there's pain, the tool, the level, the location, they're acceptable, and then you've also addressed the location, the laterality, and the quality.
Yes.
Okay, so all of those components are there. That's important.
Mm-hmm.
So tell me a little bit about why you chose the numeric tool for this patient.
So this patient, Miss Kelly, she has been able to talk to us and communicate with us without any issue. So we were able to ask her on a scale of 0 to 10, 10 being the worst pain you've ever experienced, can you rate your pain for us at this time? And she was able to clearly state that. She's completely alert and oriented, so there was no doubt that she knew what she was answering to.
Besides explaining the scale of 0 to 10, do you have any sort of reference for her?
Yes, we do. In each room, in our file folders, we have a laminated sheet that we can pull out that demonstrates the numeric and the faces pain scales, so that way they can look at it and not just listen to what we're telling them.
Okay. Okay. And then also I see that you have the time pattern here.
Yes.
Addressed.
Yes, so that's where we can document whether the pain was intermittent or constant.
Okay. So can you tell me about, when you would do a pain assessment for your patient?
Yes, so per our policy, we are to do a full pain assessment at admission in every shift, and then as needed throughout the shift if the patient is experiencing pain.
Okay, so let's talk about, let's say, in this case it looks like your patient is having pain, it's an 8. Can you tell me about your policy for pain reassessment and when that occurs? After you.
So as far as reassessment goes, it depends on the route that the medication was administered. So if we give anything IV, IM, or sub-Q, we have to follow up within 30 minutes from the time the medication was administered. If it's oral, it's within 60 minutes, since it takes longer to have an effect on the patient usually.
Okay, Jamie, can you show me some of the pain reassessment documentation that you've done for this patient or that's been done previously?
Sure. So whenever we administer a medication through the MAR, as soon as the medication has been administered and signed by the nurse, there's a form that comes up, and it's a task for us to do a medication administration follow-up. So basically, we would document our entire reassessment of that patient's pain. So if I wanted to see that documentation, I could just right click on the actual medication that was given and go to the order info. Under results is where you will see what medication was given and the pain rating that that patient had at that time. And then here we have the actual reassessment follow-up. We're documenting where their pain was again, what pain tool we used, what level their pain is now that they've had the medication. And then we would also document on their respiratory state. So we would document, do they have unlabored regular respirations and how many they're breathing a minute. And then we would also document their level of consciousness, which is, for this patient, she's awake and alert.
Okay. Okay, and I can see that you gave the pain medication at 11:34 and you followed up at 12 o'clock.
Yes.
The patient's pain was an 8, now it's a 4, so you're within the policy that you communicated to me about follow-up time frames.
Yep.
Okay, so can you tell me, you mentioned PRN pain medications with this patient, so how would you know how much to give? Does the order give you any sort of guidance?
Actually, it does. So when you look at a order from a physician standpoint, when they place the order, the PRN reason is going to be either for mild, moderate, or severe pain. And they give us an actual guideline saying if it's moderate, between 4 and 6 on the numeric or FACES rating. That kind of shows us how many milligrams or what medication we should be giving.
Okay.
Yeah.
Can you show me that on this order, please? And we can just
Sure.
verify.
Yeah, so under the order info, you can see here that to give oxycodone 5 milligrams oral Q4 hours, the PRN reason is for moderate pain, and it gives you the ratio from 4 to 6.
Okay, great.
Range.
And also, if you can show me the plan of care for this patient, tell me a
Sure.
little bit about her and why she's here, and then if we can look at your plan of care.
She's here to have her gallbladder removed, which is why she was experiencing quite a bit of pain. So one of the plans of care that I would want to initiate for her right away would be the Alteration and Comfort plan of care. So as you can see, based off of just opening this plan of care, we have certain goals and interventions that we need to follow for this patient. So what I would do is, if there were any that were not applicable to her, which in this case there are not, all of these apply, I have the opportunity to remove them prior to actually initiating this plan of care. Once it's initiated on a shift-to-shift basis, the nurse who's caring for the patient will follow it and make sure we're working towards meeting her goals.
Okay, so you have the opportunity to individualize before you accept that plan of care.
Yes.
Okay. Well, I really appreciate your time, Jamie. Thank you so much for talking to me
No
and showing
problem.
me about, your documentation process here.
Sure. So the plan of care for this patient, she's actually here to have her gallbladder removed.